Overuse and frequent visits to emergency departments as a primary source of health care can lead to unnecessarily high costs and unwelcome consequences, such as a gap in coordination of care in patients with chronic health issues. It can also provide inadequate provision of preventative care, as emergency department physicians are not obligated to follow up with patients after treatment. All patients are instructed to follow up with their primary care doctor upon discharge from the emergency department, but many of them do not have a primary care provider for themselves. Nearly 600,000 people live in the city of Milwaukee, making it the largest city in the state of Wisconsin. I chose to evaluate the area in the 53210 zip code, as this is where I work and encounter many of this area's residents. This is a very urban area with a predominantly African American population. The majority of the people that live in this community are underinsured or underserved, unemployed, uneducated, with a low health literacy and the lack of access to primary health care. Milwaukee is the nation's 5th most impoverished city and has a poverty rate of 29%. This rate is more than double the rate for the state. The overall percentage of children 18 years and under living in poverty is 43%. The city is urban with many streets and businesses. Housing in the area consists of housing projects, multifamily units, and some older homes, mostly in disrepair. Most of the area is zoned commercial. There's not much open space, but there are a few small city parks. There is public transportation available in the form of a city bus line, as well as several taxi services in the area. There's also Uber and Lyft available for a typically higher rate than public transportation. There are many various stores in the area, from clothing to furniture stores to auto repair shops and fast food restaurants. Typically, there are not many people walking or walking around with their pets, even in the warmer months. This community is plagued by crime and unsafe conditions. There is also a small Jewish community in the area with a temple right across the street from the hospital where I work. There's a Jewish community center and also an elementary school. There are other churches of various religions scattered across the community. Based on the patients I see in the hospital where I work, I have identified that the people living in this community suffer from lack of primary care providers, oral health services, behavioral health services, and health literacy. While the city of Milwaukee has approximately 600,000 people, I chose to focus on a smaller area of the city, specifically the neighborhood of Sherman Park. According to the 2016 City of Milwaukee Health Report, published by the City of Milwaukee, there are 3 major health concerns facing its citizens. The main concern at this time is lack of access to primary health care. Many of the people living in this area have many barriers to obtaining a primary health care provider. Some of the barriers that need to be addressed are lack of transportation, long waiting times for appointments, lack of knowledge about the importance of primary care, which is also often a result of low health literacy. People living in this area also have a limited access to dental care as a result of the same issues associated with primary health care issues. Another main issue identified in this community is safety. The rate of violence plaguing this community is astounding. As of April 2018, there were 1,401 accounts of assault, 1,148 shootings. In a 2015 survey conducted by Children's Hospital of Wisconsin, it was reported that more than 5% of survey respondents felt that their child was seldom or never safe in their community. Information gathered by this survey indicated that the high rate of violence is driven by multiple complex causes, and it affects the entire community. Some of the key drivers of violence are unemployment, lack of education, and lack of community programs. There are several health facilities in the Sherman Park neighborhood. The main healthcare provider to the community is St. Joseph's Hospital. St. Joseph's Hospital lies at the center of Sherman Park and is at the heart of the community and has been for over 130 years. St. Joseph's Hospital offers primary care, emergency medicine, and many other services. Frequent visitors of the emergency department at St. Joseph's Hospital have many complex issues. The nursing diagnosis related to these issues is risk of deficient community health among the members of the Sherman Park community, related to the lack of access to primary health care providers, lack of health literacy, and health promotion. Limited or low health literacy is a barrier to understanding health information and has been identified as a risk factor for overuse of the emergency department. Overuse and frequent visits to the emergency department as a primary source of health care can lead to unnecessarily high costs and unwelcome consequences, such as a gap in coordination of care in patients with chronic health issues. It can also provide inadequate provision of preventative care, as emergency department physicians are not obligated to follow up with patients after discharge. All patients are instructed to follow up with their primary care doctor upon discharge from the emergency department, but many patients do not have an established primary care provider. Some studies report that up to 1/3 of all emergency department visits could be considered inappropriate or non-emergent. Some factors that are believed to be related to these non-emergent uses include lack of health insurance, patients' perception of their emergency, convenience of receiving care for their complaint on demand, low health literacy, and low socioeconomic status. Patients who regularly use the emergency department for their basic health care needs are a vulnerable population both socially and medically. Some studies have shown that if these patients are visited by the care management team while they are in the emergency department, the frequency of their visits could be reduced. Frequent visitors, or frequent flyers as they are often called, are defined as people that visit any emergency department 4 or more times within a year. Many frequent flyers are uninsured, homeless, and have a myriad of social issues. An effective care management team within an emergency department can help reduce those unnecessary visits, even if the visit with the patient is brief. Many hospital emergency departments have employed plans and interventions to reduce these visits to help reduce costs and improve healthcare outcomes for this group of people. Some studies have shown that patients with a low health literacy are more likely to receive all of their health care in the emergency department. Some patients reported that they use the emergency department as the source of their primary care because they think that the emergency department providers provide a higher level of care, or because they find the emergency department easier